Thank you everyone for joining our information session today. You're going to be learning about a new UBC Micro-certificate program, Natural Language Processing to Improve Patient Care. Welcome, I am Steph Chia. I am the Senior Research Manager at the Department of Medicine. And today I am joined by some team members from Department of Medicine who will be helping administer our info session. So Arlene and Xianghen, they'll be helping monitor the chat and questions. So let's get started. I'd like to acknowledge that today's meeting, I am joining in from Vancouver, British Columbia, which is located on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I also want to acknowledge that many of you may be joining from various locations and territories in BC, maybe across Canada and beyond. And I also want to acknowledge the traditional caretakers of those lands. If you'd like to share where you're coming from in the chat, please feel free to do so. So for our info session today, this is the agenda. We'll start with a few welcome introductions, going into some details of why we developed the program and who it's designed for, and how we think this program could help you, and then talk a little bit more detail about the different courses and what the curriculum involves, and how it's delivered. And then we'll have a lot of time at the end for Q&A. So we welcome you to ask questions throughout the info session. We'll ask that you submit your questions through a Slido link. So if you go open to a new browser and enter the Slido code here, or use the QR code to get to the Slido sheet, you can enter your questions there, and we will look at them at the end of our info session. I'll show the Slido link again before we get to the Q&A, and then I think we'll have the link in the chat as well. So I'd like to introduce our program leaders. We have on the call today Dr. Anita Palapu, who is a professor and Eric W. Hamber Chair. She is the head of the Department of Medicine at University of British Columbia and Providence Healthcare. She's also the co-lead of the Data Science and Health, or DASH, Research Excellence Cluster. We're also joined by Dr. Raymond Ng, who is a professor of computer science at the University of British Columbia. He is the director of the Data Science Institute, and he is the holder of the Canada Research Chair on Data Science and Analytics. And both Dr. Palapu and Ng are together the co-leads of the newly formed UBC AI and Health Network. We also are being joined by our two course facilitators. So these course facilitators will be present during the actual course delivery and will be connecting with the learners in each cohort. First, we have Saffron Granby. She is a data scientist working at Vancouver Coastal Health. She's passionate about integrating natural language processing solutions and analytics into our healthcare system. And she works on quality and patient safety initiatives, conducting topic modeling on large text data sets and developing deep learning text classification models. We also are joined by Trevor Kwan, who is a resident data scientist at the UBC Data Science Institute, where he builds transformer-based NLP systems that extract key information from cancer reports to flag high-risk patients and accelerate care pathways. He has done a master's in statistics, where he investigated a novel predictive modeling method that improved diagnostic accuracy using patient covariance. Okay, so I'm going to pass it off to Anita to tell you a little bit more about why we developed this program.
Thank you so much, Steph, and welcome to everyone today. So our goal with this program was to make sure healthcare professionals, whether they're clinicians, researchers, or administrators, gain three key things. So the first is a solid ground on the basics of natural language processing. The second is meaningful hands-on practice, working with real tools. And finally, clear practical examples of how NLP can be applied to real healthcare challenges. So next slide. So a vast majority of data that are generated is in healthcare is text-based. However, such data are often hard to interpret and analyze by non-human experts and automated algorithms. So natural language processing and large language models are starting to gain momentum in tackling complex text-based data, and this has been spurred by the rise of ChatGPT. So NLP helps us summarize, classify, extract key information, and understand patient needs from large volumes of text. So this translates into less manual review, better decisions, and more time for patient care. So we're seeing a massive shift in how clinicians manage documentation and clinical text. For example, the AI scribes, the tools that listen to patient encounters and generate draft notes, are direct applications of natural language processing. And they're being adopted at unprecedented speed by healthcare providers and clinical staff without a true understanding of how these tools work. So, understanding how these systems work and their limitations is becoming an essential skill in modern healthcare. So, this program teaches the skills needed to understand, evaluate, and apply these tools safely and effectively. So we designed the program for healthcare professionals, and these healthcare providers range from clinicians, nurse practitioners, clinic staff, administrators, operations, and strategic personnel who work with patient healthcare data. So researchers working with clinical data, data scientists and analysts who are new to NLP and healthcare applications. And we see more job postings in Canada requiring NLP and healthcare analytics skills, and various roles from entry-level patient care coordinators to senior data scientists and registered nurses, emphasizing really the widespread application of NLP skills across these healthcare professions. So our program is also endorsed by the health authorities and received funding through the BC government's Ministry of Post-Secondary Education and Future Skills. So over the 3 courses, you will learn how to explain core NLP concepts, including LLM or large language model capabilities and their limitations. You'll learn and practice NLP skills like classification, extraction, topic and sentiment analysis to various healthcare text examples, summarize long clinical and patient texts, critically evaluate model outputs, looking at accuracy, bias, hallucination, and privacy, as well as design responsible NLP solutions for real health problems. So our program will enhance the data literacy of healthcare providers and researchers, giving you the skills in NLP to meet today's workforce needs. So I'm going to hand it over to Dr. Raymond Ng to give us more information about this micro-certificate. Thank you.
Yes, so thank you, first of all, for all of you to come and allow us to give you an overview of the micro-certificate program. Just the program itself consists of 3 separate courses. The first one is the overview of natural language processing and large language models. So this is just giving the basic concepts, laying the foundations for the next 2 courses. Now, in the healthcare, there are two general kinds of text data. One, as motivated by what Anita said, is clinical documents. There's huge amount of clinical documents in hospitals, in clinics, and the idea is that if we could extract accurately from these clinical documents, that would allow us to provide much more effective downstream analysis of the content of this clinical document. So this is the second course. Now, but it's not only the clinical documents. Clinical documents are prepared by healthcare professionals. The other types of text in healthcare, and one would argue that is just as important, is what we call user-generated content. So here the user may mean the patients, their families, their caregivers. And here we want to understand what are they saying? What are they saying about their conditions? What are they saying about their preferences? What are they saying about their drugs? What what is their mood, etc. So this is the third course. So next slide, please. And so I'll go a little bit one step, more detail on each course. So in course 1, we are learning about laying out the motivation, what NLP actually does in a healthcare setting, and why would it help the clinicians or the patients. We want to show how large language models work at a practical level, a little bit of, if you will, opening up the black box of a large language model and show at a very high level some of the details within a large language model. We talk about prompting, asking good questions to the LLM so that the LLM can give us better answers, can give us more accurate answers. And here we will talk a little bit about how we could therefore use the LLM a little bit more responsibly and a lot more safely in a clinical and operational setting. We will talk about how to spot errors, hallucinations, bias, and privacy risk. So next slide. Yeah. And so, but within that, we also be going through some of the text processing techniques, stemming, lemmatization, tokenization. You will hear some of these terms if you use some of these tools, and this is just to provide a basic literacy on NLP techniques. And the ultimate goal in course 1 is to discuss a little bit how real-world clinical problems may benefit from various types of NLP tasks. So course 1 is about a general overview of NLP, large language models at a high level as it applied to healthcare. In course 2, we are now going to dive into one arm of the analysis, clinical documents. So we begin with clinical documents because, as I mentioned, we have a lot of that in our healthcare system. And we want to be able to use that to categorize different types of clinical documents. We want to use it to extract key pieces of information out of the clinical notes. To give you an example, we do a lot of work, for example, in cancer pathology. And so we might have a pathology report and we want to pull out, whether the pathology report mentioned about specific types of cancer, where is it, how large is it, what is the severity. And so these are key pieces of information we want to extract from this kind of clinical documents. But then beyond specific target fields of interest, we might actually just want the NLP to summarize long clinical notes so that it provide a concise but an informative overview of what the clinical document says. We might also want to ask the NLP tools to help us answer specific questions. So to come back to the example that I have about cancer pathology report, there's a report, maybe the clinical questions that we want to ask is that, does this pathology report indicate that there is a cancer involved? And if it does, what types of cancer? So this is called question and answering. And of course, we want to make sure that in doing all this categorization, extraction, and summarization, we want to make sure that we understand the limitations of these tools so that we could use it more accurately and more safely. And of course, it's always privacy, protection, and confidentiality. It's always critically important. Next slide, please. And so just to highlight that, we will be using examples of some of the work that we have been doing at BC Cancer Registry, Vancouver Coastal Health, and then as part of the course, we have very hands-on assignments with Python, Jupyter Notebook, Google Collaboratory, and to work on some real world use cases. And I want to emphasize that there's no programming required. We will provide all the code, and you'll just be trying to use the code, and so that you see what is happening when you apply some of these tools to a real world setting. And of course, you want to be able to interpret the results as well. And we also want you to see, sometimes the errors, and we will need to understand, the nature of the errors. Some errors are more critical than others. So I think you'll learn all that in the labs and in the assignment. So then we go to the last course, which is the other side of it, non-clinical documents as prepared by healthcare professionals, but this time user-generated content as provided by the patients, the families, their caregivers. So the first thing is we want to be able to understand what the patients have to say, whether it's a comments, reviews, surveys, email, messaging, and we want to understand what topics are they talking about. So the specific brand or the family of NLP techniques here is called topic modeling. So we will introduce topic modeling. We will talk about how we could identify patients' needs and the emotional tone when they provide that content. We want to be able to summarize long conversations with the patients and into clear, usable, summaries, and identify, for example, actionable items as to what their needs are and so on. And in some particular cases, we might also be able to identify whether the patient or whether the user is coherent or not. So this is very neurologically important for certain conditions such as dementia and psychosis. Next slide, please. And so the highlights is we'll talk a little bit about mood analysis, sentiment analysis. They're very different, and you'll learn about that. And of course, we want to be talking about how large language model is enhancing all these NLP tools. And then the last but not least, going back to what Anita said earlier about AI scribes, is rapidly being used by healthcare providers. And so we will talk a little bit about, in the context of NLP, large language model, the different, almost like do's and don'ts about AI scribes. And in fact, I think we end with some projection as to what the next generation of AI scribe should be doing. And so that's roughly the 3 separate courses. I think I want to emphasize that it makes sense for course 1 to be the first course that you take if you don't have the background. But if you think you have the background, course 1 is not necessarily a requirement. And then between course 2 and course 3, there's no particular order. In fact, you have to take them because they are talking about different types of text in our healthcare system. And so I think with that, I'm going to pass it back to Steph.
Thank you, Raymond and Anita, for providing that overview. All right, so now I'm going to just talk a little bit about how our program is delivered. We developed this program to be flexible for working professionals. So the course is 100% online. And we have, during the online time, you can look at these asynchronous video lectures that we've recorded, and we'll have assignments that can be done on your own time according to your schedule, and discussion boards. We think it'll take about 5 to 6 hours a week to complete those activities. And we also have an optional synchronous Zoom office hours. These are optional. So it could be, if you have some questions about some of the content you learned, we'll have our course facilitators present during that online time to answer your questions and kind of talk about what the content was that week. So each week you're kind of given, we pace it where you can access all the modules at the beginning, but we kind of designed it to do 1 module per week for this first course. And then some of the other courses are shorter modules. So we'll give you some pacing examples of how you might work through the content each week. And there will be so we also received accreditation through the UBC Continuing Professional Development. So any physicians, you can claim these MOC and main pro credits if you are interested in taking the course. So the program delivery schedule is for the 3 courses, each one is 5 weeks in duration. And the tuition is $9.95 per course or $29.85 for the whole program, where you achieve the micro-certificate for doing all 3. The assessments are based off of the self-check quizzes and the assignments and discussion questions, and you need a 70% to pass. So this is the upcoming schedule for the 3 courses. The course is launching. First course, overview of NLP and LLM, is launching March 10th. And then the second course starts on April 21st, and course 3 on user-generated content is June 2nd. So if you were to register for all 3 courses, you could be achieving the micro-certificate within 4 months. And we'll share links to the registration page if you're interested in learning more. We're also going to have a second offering later in 2026. So you can look out for that if you're not able to do all 3 in this first set. Okay, so now we're going to switch over to our Q&A session. So I'm going to stop sharing and then we'll load up the Slido questions. And then we'll have Anita, Raymond, Trevor, and Saffron here to answer your questions. Okay, so first question is, are nurses without any coding experience appropriate for this program? I know, Raymond, we mentioned no programming experience, no coding experience is necessary. So I think the answer is yes. But Raymond, would you like to add anything to that?
I mean, not really, but I think, I think that we design the content with nurses in mind too. So, clinicians and healthcare professionals in mind. And so I think it will be very appropriate. We don't really expect any coding or machine learning experience or NLP, prior background. And so it really just, starting from scratch in a way. But of course, we don't dive very deeply into it. We just want to make sure that you get just enough so that you could survive all 3 courses.
So the second question is, are there opportunities for networking and building AI agents? And I'm not sure if those are 2 separate questions that they're asking or the networking, there is like the discussion questions is a chance for you to kind of interact with your fellow learners in the cohort. And then the online office hours are really meant to help the learners bring together the learners and have a chance to meet who else is taking the course with you. And I know in our previous micro-certificate, a lot of people did and build up what we kind of had wanted to build up the community of practice of people who were interested in the topic. So I think there's definitely the opportunity through the office hours to learn and meet the other students. But other than that, then after that, you might want to connect with students to continue discussions around the topic if you want to meet up. And then the building AI agents piece. Would anyone like to take that question? Yeah, Raymond.
Yeah, so there would not be any content on agentic AI in this micro credential program.
Okay, so this is just about course enrollment. Is there a course number I can search for? There is a course number. It's through UBC's extended learning. The program is offered, so maybe we can have our team send some information about that after if we can't find the course. Great, thanks, Neha. Okay, next question is, what is the split between NLP theory versus actual extraction and analysis of data? Are any courses in this micro-certificate geared towards the latter? Would maybe Raymond or Saffron or Trevor want to? Saffron?
I can just say in courses 2 and 3, there is more of a focus on showing the process of extracting data. And again, you're not actually coding it, you're just looking at the code and you're pressing like a button to run it. But we do show a simulated data extraction process in those two courses.
And maybe I'll add that in terms of the NLP theory, it really depends on what you mean by theory. But I think at best you will see a little bit of that background concept in the first course, because that's trying to set up the background to make sure that we understand some of the nuances in dealing with human text. And so there's a little bit of that in course one. And then just to confirm what Saffron said, course two and course three is really very focused on extraction and analysis, building models, and doing various types of NLP tasks. So it's very practical in that sense.
Okay, so next question is about the second offering. So yeah, we showed the dates for the very first offering of this micro-certificates, which is the March to July dates. And then we'll be running the 3 courses again, which is going to be in the fall, starting September, I believe. So it's like September to December is the dates for the second offering. Okay, so this next question is about, is it possible to do only course 2 and 3 if we already are familiar with LLMs? Raymond kind of mentioned it, but he said yes, because the course 1 is a foundational, is really for people who don't have much experience with NLP or the large language models. So that's the foundational course. And yes, you can definitely do course 2 and 3 if you already feel like you have that foundations and understanding of what NLP is. Okay, is there any training connection with ethics and privacy to help translate training afterwards to real-world projects? Would Raymond want to answer?
So I don't think the 3 courses will explicitly identify ethics and privacy as an individual component, but it's all spread out into when you're using training data, and then when you're applying the model, some of the issues, some of the pitfalls that we have to be careful of. But it's not like there's a specific component in each course that we'll be focusing in on that. And with that, I would probably say that for some of you who might be familiar with our other micro-credential program, which is the health data analytics, I think there is actually a course there that talks a lot more about ethics and privacy. So this is one of the reasons why we don't want to kind of duplicate some of that content in this NLP micro-credential program.
Okay, our next question is just about like the commitment. How many hours would each course take? Is that possible for current medical students to enroll? So we are estimating about 5 to 6 hours per week. So over 5 weeks, like 25 hours per course is what we've tried to target. So medical students, I don't know if Anita, do you want to maybe comment on whether you think the workload would be manageable?
I think it depends on what year you're in. I suspect if you're in clerkship, I don't think you could manage, but maybe in year 1 and 2, depending on how you're managing with the course load. It's also just, you have to balance everything because you also need time to take care of yourself because year 3 is very intense. Year 4, you might actually have a little bit of time, but you also, before your residency, you also need to take time to take care of yourself too. So if you're super interested, something that you could explore, but I think it's also around managing your time wisely so that you're doing
Yeah,
okay.
maybe they wouldn't take all 3 courses at once. If you
Yeah.
took 1 course and then take a break and then do
Yeah.
the second offering for course 2 or 3. Okay, this is an interesting question. Where are the data stored? Does the scribe conform to FIPPA and PIPA laws? I don't know if maybe you would like to, because we're not actually storing the data from an AI scribe.
I'm not sure if they're talking about the AI scribes. So all of the AI scribes that are used by within the health authority are health authority approved. So they have gone through a privacy and ethics assessment for providers to be able to use them. But people who are in private practice, it's not always clear where they're holding the data if they're using something that's not been approved by the health authority. But I do think if you're within the health authorities, that you have to use one of the approved vendors for the AI scribes.
So actually, to the best of my knowledge, all the scribes approved by the health authorities are all Canadian vendors. So now Canadian, vendors doesn't mean that they cannot store the data elsewhere, but I think at least they're all made in Canada. But again, I think in the course we actually talk a little bit about how a user of AI scribe needs to really read the fine print, really need to understand what is being done, so these are very, very important and serious questions.
Yeah, I was getting confused. I was saying that we don't have any data stored in our course materials, but that's good to clarify. And now a question about the limit to number of participants per course or cohort. Yes, well, we will have a cap because we want to maintain control over the amount of, for our course facilitators and TAs working with the students, we want to be able to have a good number per ratio. So I think our cap is going to be about 40 people per course. And so, yeah, if you're interested, I'd encourage you to register before that cap gets met. Okay, so I think that as a comment, I think that ethics and privacy aspect is extremely important and should be addressed at any discussion teaching of this technology. Very valid comment. And I know we do address parts of this in the teachings as well, but I don't know if Raymond or Anita or Saffron you'd like to, and Trevor, feel free to jump in because I do know we do touch on that. Yeah, I think so. So Raymond's, Saffron, go ahead.
Oh, I was just going to say a lot of the assignments as a part of after doing some of the technical work, there's checking questions about asking the students to evaluate what they think the ethical problems or risks about doing that type of work. Like, let's say something goes wrong with your model, what could be the downstream consequences of that? So just it's within that realm of ethics and privacy of understanding risk and how using these models in the healthcare system could have good consequences, but also bad consequences as a part of a lot of the assignments.
Okay, the question is, what are some added benefits of taking this course? What career professional growth are possible with it? Does anyone want to take that one?
I can speak a bit to working with clinical champions as a data scientist. It is really important that the clinical side is leading a lot of the changes and integration of AI. They're the ones that are going to be identifying the use cases that are going to be the most important for improving patient care. So to have people that have an understanding of NLP going into these conversations and knowing what's possible, knowing the risks is so important. So it's really, really great working with clinicians that have that context of NLP, even if they're not the technical domain experts, like having that understanding when you join the conversation is just super helpful.
Exactly.
So perhaps I could add that I think it's important to understand that the micro-credential program is really for literacy. And the intent of this program is not to say that graduates of this program will be able to practice as a professional NLP, healthcare, data scientist. This is just to give the the foundational concept, the first layer of what NLP can do and what NLP cannot do. And then I think if a learner has decided that this is the right area for them to grow into professionally, then they have to get additional education. One of the possibilities is to go to the UBC, Masters of Data Science program, and as one option. So this is just an entry point to let the learner understand what the concepts are about, and if you are a casual users of the technologies, what would that mean? But if you are wanting to become a professional health, data scientist in healthcare, then you need to get additional training.
There's a question about, is there an option to audit the course, i.e. no certificate at the end? This has come up recently for our other micro-certificate with UBC, and I wasn't sure what the answer was for auditing. So I will have to get back to this person on that, on the answer. So if you could just, at the end, we'll also share just the email that you can ask additional questions. So we can let you know about the auditing ability. So our session is recorded today, and there will be a link shared to anyone who registered for the info session. So you'll be able to rewatch our presentation. And then our final question, unless there's more coming after this, is, would this course allow you to develop an AI tool to analyze a registry for a particular medical condition? Yeah, so I'm going to say probably it depends, but we'll let if anyone wants to comment.
I think it would depend on your like comfortability with coding to begin with. I think that we're providing you with code that is doing some similar, data classification and extraction. But I would say if you don't have maybe a background in Python and a little bit of that understanding going into it, it'd be difficult to transpose the code there into trying to analyze a registry. And additionally, there's a lot of pre-processing that you would have to do to even get your registry data ready and tune it for that particular medical condition. So I think you could have an understanding of how you would do it, but I think it would be difficult to actually transpose it just using the content and knowledge from the course.
The next question is quite interesting too. Someone with a machine learning and NLP background, but is new to healthcare. And how can I best work with the facilitators to identify advanced side projects that go beyond the standard assignments? Yeah, maybe Saffron or Trevor, you want to comment?
Well, I think when we do provide an initial data set, if you have other interests of how you could use it and going beyond what is there, you could do your own exploratory data analysis and your own modeling with the data. I think that that's a way that you could go beyond what is given in the labs already to have a side project potentially.
Yeah, so the standard assignments, they're geared towards the training in the course, but we do provide Zoom office hours to discuss potential advanced further opportunities to be able to discuss things that are perhaps more technical, yet still applied to the healthcare domain.
Yeah, that's great that someone wants to go further and do some more advanced projects. Okay, a comment is, it's good to consider an official degree in this area for non-coders. Many things are changing that need clinical input, but clinical staff are not trained in this. Yes, that's very true. I think we are not at the place to offer official degree, I think, for the clinical side, but just we are doing a lot of data literacy and training for different clinical types of people. Like we're also working on something for the residents in like a smaller workshop thing. So I know there's a large need for this type of education for the clinical staff and physicians. But yeah, I think that's something to consider for how we could work with UBC maybe in a or expanded program. Well, I think we'll show that there's a big success and a lot of need with the people taking this current micro-certificate. Okay, is there any more questions that haven't been answered? Okay, well, if that's the end, you can also, maybe we can just share the email that we'd want some questions for. Which is the info.exl@ubc.ca. So if you have any questions that weren't answered today, please feel free to send those to our email. But we would like to thank you all for joining our information session today. We hope you learned a lot about the upcoming micro-certificate, and we encourage you to register if this is something that might interest you. Again, the first course overview of natural language processing and large language models starts on March 10th. So please do register if you want to, and we hope to see you there. Thanks, everyone. Have a great rest of the day.